Specialized footwear, but it serves the purpose and at the same time, it's very comfortable and convenient to the patient. So we are happy to be a part of this journey of yours. We know the start is just the beginning. We are long way to go in developing this department, and as the CMI, with Ramesh support, as the CMI had the plans to scale up to 900 bed facility. Right now we are 500. We are going to add 400 beds more. It's not about the beds alone. We take all this department comprehensive in terms of infrastructure, equipment, facility, and also it's not about putting up the infrastructure. We design this place to keep the comfort of the patient, comfort of the people, and the staff working there as a priority, so that this hospital will become future-proof. We have hospitals now. What is the need of the hour in hospitals, which is contemporary to the requirement of the patient and the doctor?
Really, it is such an auspicious day to inaugurate such a technology which we will be adopting through our lead consultant who has taken this initiative, Dr. Krishna Chaitanya. And with this addition of this diabetic foot care, which is going to be one of the technology which we'll be adopting to give that clinical excellence to the patient. So I'm sure this Aster Diabetic Foot Care Center will be center which we have adopted the AI technology with the AI algorithms to understand the patient, and using the gait also we are able to deliver that kind of good solution to a patient who's actually desperately in need. So that is where I think the whole difference will be, where I'm sure Dr. Krishna Chaitanya would be taking us through the entire technology, how it really works. Now, one question which would always arise is why a vascular surgery department? You know, this peripheral vascular disease has been very, very common among the diabetic patient, which goes unnoticed many times. And earlier, as you rightly said, we are evolving from um, the diabetic patients, as you can see, is on the rise. And if you don't take care of yourself, especially the quality of life, imagine if your foot is not having the right footwear and not able to walk. That is the biggest drawback which a human being, the quality of life is going to deteriorate back. Now, what is important today is how we improve the quality of life. It is not. It has gone from the good old days of communicable disease to a non-communicable disease. So anybody now, 50%, almost nearly 50% of the population do have either diabetes or hypertension, which is going to be hampering the lives of people. So diabetes, and especially when it comes to peripheral vascular disease, it's going to make a huge difference. The vascular surgeon is going to make a big difference out there. So I'm sure, way forward, the focus of Aster, as rightly mentioned, we will be focusing on center of excellence. We want to create that center of excellence, ensure that each and every department excel in whatever they have. Best of the technology is what we are going to adopt. That is, technology is going to aid a clinician. Clinician is always there, and even if I buy the best of the robot or best of the technology is still going to be a slave to a clinician or a surgeon. So that is not going to overtake, but it can aid and support and give us better results. So,
Delighted on this occasion of National Vascular Disease Awareness Day that we are able to inaugurate the Aster Diabetic Clinic, and we don't care to maintain that. That is where we come in, the plumbers of the human body, as we say. So, is it that common that vascular surgery is? There are several studies. I do not say numbers. Several studies have put the figures of peripheral vascular disease, the disease where there are blockages of blood flow. It affects about 10 million people in India. That's a huge number. And not just one study. There was a study by SAGE Group. The SAGE Group is a group which does analysis. They get statistics from the population, they conduct survey and produce it to the industries so that the industries look at the feasibility of whether this product can be launched on our. If that all this vascular disease was more of a Western disease, but that doesn't appear to be so. Indians have a similar or a higher rate of peripheral vascular disease. They've also concluded that due to high number of diabetic population in India, the Indians might actually be suffering from higher burden of peripheral arterial disease than the Western population. For about 1.4 billion, we have at least 20% of the population who are at risk of peripheral arterial disease. As we know, India has a heavy burden of diabetes. As on 2021 data, there are 77 million diabetics in our country. And various data from different parts of the countries put the incidence of diabetes as 14% in our country. If we look at this into Bangalore, we have about 20 lakh diabetics in Bangalore alone. 15% chance of developing a diabetic foot ulcer. So the burden of diabetic foot problem in Bangalore alone is about 3 lakh patients. And with this challenge, we have launched the Aster Diabetic Clinic today, which offers a comprehensive solution to all diabetic problems.